Thank you, Mr. Witty. Let me begin with this. This hack could have been stopped with Cybersecurity 101. And I'm talking specifically about multi-factor authentication, MFA. When your bank app asks you to enter a code sent by text or email, that's MFA. It secures your account even if your password is learned. Yet your testimony reveals this first server that was hacked didn't have multi-factor authentication. So question one, I'd like a yes or no answer to, Mr. Witty. Prior to the hack, did you or any of your senior management know that UHG was not requiring MFA company-wide? Yes or no?
Mr. Chairman, thank you for the question. Our policy is to have MFA for externally facing systems.
So if the answer is yes, then that makes my point that on your watch, there was a cybersecurity failure. And then that's what caused the harm to patients, the healthcare sector, and your investors. I don't believe there are any excuses for that. So my second question is, will you commit within 6 months at the latest to require multi-factor authentication company-wide and meet the tough MFA standards that are required of federal agencies? Again, a yes or no answer.
Mr. Chairman, yes, I'm happy to commit to that. In fact, I can confirm to you that as of today, across the whole of UHG, all of our external facing systems have got multi-factor authentication enabled.
We will take that as a yes. It shouldn't have taken the worst cyber attack ever in the healthcare sector for an agreement to do this bare minimum. Now, second, with respect to national security, people claiming to be involved with this hack have asserted publicly that they stole data on U.S. government employees, including active duty U.S. military service members. My colleagues remember the 2015 hack of OPM government personnel data, which obviously posed very serious counterintelligence concerns. And I am very concerned, as I said in my opening statement, about the national security implications of this hack as well. Are you in a position this morning to say whether the hackers stole data pertaining to U.S. government employees?
Mr. Chairman, thank you for the question. Like you, I'm extremely concerned about any patient's information, but particularly in the context you just described. So far, through the process of working through the data, what we've been able to identify is indeed a substantial proportion of people across the country's data could be implicated here. We do believe there will be members of the armed forces and the veterans associated.
When can you give us in writing the number of military personnel affected and your best assessment of who they are? Can I have that quickly?
I give you my absolute commitment. That is
a week?
Top priority. It will take longer than a week, but as fast as we possibly can, we will get that.
This is a national security priority, Mr. Witty. 2 weeks, I expect it.
We will absolutely prioritize that, sir.
All right. Let's talk about why things are taking so long, and particularly how hard providers are being hit, because they're paying the price for the failures that have been made on your watch. How much longer will a provider who sent in a claim for services delivered in February have to wait in order to be paid?
Mr. Chairman, thank you for the question. Our belief at this point is that claims flow across the entire country is essentially back to normal. Certainly from a UnitedHealth Group's perspective, we are paying claims as soon as they arrive. We're aware that other companies may not be paid as quickly.
Providers are telling me it's going to take until at least June to clear the backlog. Can you do that earlier?
We can move absolutely faster than that. And in the meantime, we are providing financial support.
When can you expect to have that cleared?
We believe the system is broadly back to normal. Now, if there are any providers in state who you'd like to refer us to, we can make sure that they are particularly
Practically
addressed.
every provider I bump into is waiting to be paid.
Those payments from United certainly have been made. We are caught up, and we continue to advance significant interest-free loans for others.
Will you commit to waiving deadlines for timely filings and appeals for claims until everything's back in order?
Yes, sir, we have already waived those.
Will you
deadlines.
commit to paying meaningful compensation to each provider and plan whose business operations you disrupted?
So we're happy to engage with providers to discuss that.
Please send that to me in writing, how the compensation system would work. Let me mention one other area very quickly. I've been following your various comments, and consistently, your views seem to minimize the impact of your involvement. You say that UnitedHealthcare payments processing accounts for only 6% of payments in the healthcare system. My view is that's basically hiding the ball. In 2022, the Department of Justice said the change retains records of at least 211 million individuals going back to 2012. So how many people have actually been impacted? Where did you find those files? And what medical information was stolen? I need answers to those three questions. How many have been impacted? Where did you find the files? What medical information is stolen?
Mr. Chairman, thank you for the question. As I've said, that is very much a top priority for us to get to the bottom of. We're working our way through that. As of this point, we have not identified anything like medical records or medical histories. What we have seen is claims information.
But you don't have the logs that would show what data walked out the door, because we have been working to get that and we haven't seen it. Senator Crapo.